We turn now to the coronavirus pandemic. Vaccinations are speeding up across the U.S., but infections have been rising for a fourth straight week. The nation administered more than 4 million doses Saturday. That is a new record. So far, nearly one-third of the population has received at least one dose of a vaccine. Meanwhile, total cases in the U.S. are nearing 31 million. The death toll now stands at more than 555,000. And those numbers are on the rise as young Americans lead the latest surge. David Begnaud reports from Michigan, the latest epicenter.
We're very, very, very close to being completely full.
Tonight, the newest COVID epicenter is Michigan, and it's a mystery as to why.
I don't know what's going on here. Michigan is just one of the hardest hits.
39-year-old Scott Neiswanger says his son may have gotten infected at his daycare center.
We all went and got tested and all came back positive, and it's just been downhill spiral since then.
He's been here at Lansing Sparrow Hospital since Friday.
Just feels like somebody was sitting on my chest. 500-pound guy sitting on my chest, and I just couldn't push him off.
Nationwide, the latest spike in COVID cases is driven by younger Americans, according to the CDC.
We are learning that many outbreaks in young people are related to youth sports and extracurricular activities. According to CDC guidance, these activities should be limited.
Also, there is a spike in the B117 variant that originated in the UK and is now believed to be responsible for a third of all the cases here in the United States.
We know that B117 is more transmissible, somewhere between 50 and 100% more transmissible. Whether it's more transmissible specifically in different age demographics, we don't yet have evidence.
Look at this jump in new COVID cases here in Michigan.
All done.
But there's also good news nationwide. 4 million vaccinations were reported on Saturday alone.
Now, more than 1 in 5 American adults is fully vaccinated, and 40% have received at least one dose. And just today, Michigan said anyone 16 years or older can be vaccinated, joining 27 other states in expanding eligibility and essentially saying if you want one, come and get it.
You get so excited because the vaccine is out, and it's a little bit disheartening to see the spread outpacing the vaccine.
What's going through your head as you ride another wave?
Here we go again. We're just trying to hold each other up and stay positive as best we can.
You know, where we are in Michigan, it's interesting. Cases are rising the fastest among people 9 to 29, but case counts are the lowest among those 70 and older. It's the 70 and older that account for a majority of the people who have been vaccinated. Think about that. Also, today, CDC said fogging, fumigation, and electrostatic spraying, which is actually what a lot of the U.S. airlines use to kind of disinfect the planes before we get on them and fly. They said that those methods should not be used as a primary cleaning method because there are several safety risks to consider. Elaine, back to you.
David Begnaud, thank you. Dr. Susannah Hills joins me now. She's a pediatric airway surgeon and an assistant professor of head and neck surgery at Columbia University's College of Physicians and Surgeons. Dr. Hills, welcome. The director of the CDC says this is now the 4th week of rising infections, and she says variants are largely to blame. How do we turn this trend around?
I think we already know the things that are so important to do to help keep the case transmission levels low. The challenge in this moment is doing those things while the vaccination program is going so well. People are experiencing COVID fatigue. People want to get back to their regular lives, and we have a vaccination program that's going really well. But what this rise in case numbers that's been prolonged, what this surge in certain areas of new cases is telling us is that we are still at risk. We've got increased numbers of the B117 variant across the country. There are now over 11,000 cases documented, and the actual numbers are much higher because we don't do genomic sequencing in most of our testing. And we know that more and more kids are now being affected. That's sort of the leading age group for increasing case numbers. So we've got all of these things that are happening that are telling us that this pandemic is progressing still. It hasn't been controlled yet. And so while our vaccination program is going so well, we've still got to continue, unfortunately, to do the masking, hand washing, social distancing, those things we know are going so well. And I would also say that I think some of these measures for reopening are perhaps progressing a little too quickly. And I think states where the case numbers are not going down need to reconsider their restaurant capacity, opening of stadiums, youth sports, all of those things. They need to press pause and maybe take a step back just for a moment until they get the case numbers headed in the right direction again.
So on that point, I mean, as you mentioned, infections in the U.S. are spiking among younger people, including children. In the past, experts said there was little transmission among kids. Are you concerned about schools reopening right now? And what are your thoughts about the need for a pediatric vaccine?
It's a tough balance, between getting kids back to school and the very valid concerns about transmission, particularly among young people and with the B117 variant, which appears to be affecting children more frequently. But we've now approached a point where this pandemic has gone on for over a year. Kids have been out of school for months on end, and that is becoming its own critical public health crisis too. I think the CDC outlined some really well-founded guidance on getting back to school last month. Those measures of mask implementation, consistently using masks, distancing kids 3 feet, 6 feet in certain areas where case numbers are increasing, and doing the hand washing measures that we know are so important. I think those are measures that will keep students safe in school. We saw them keep students safe in school last fall when we looked at kids using masking, social distancing, hand washing. The transmission rate was very low. We do have this variant strain. The scenario is evolving. So I think things like group sports for children, that probably needs to be reconsidered. But I think we can do things to keep our kids safe while they're in school, while we work actively to control the rate of spread in the surrounding community. Of course, as you just mentioned, getting a vaccine for kids is going to be a huge step forward for everybody feeling safer with kids being back in school. I'm thrilled to see multiple states are opening vaccinations for kids 16 and up. So great thing for kids, for teenagers who want to safely get back to school, safely engage in activities that are so important to them. And we're getting closer and closer to getting a vaccine that hopefully will be safe for kids. Hopefully the Pfizer vaccine and Moderna and potentially Johnson & Johnson will have data to be giving kids vaccinations before the school year this coming fall in the younger age group. Preliminary data that came out just a couple weeks ago showed that indeed the Pfizer vaccine appears to be very safe and effective in kids who are 12 to 15. We are now studying that in kids who are as young as 6 months old. So hopefully all of that data will help us get younger and younger kids vaccinated as well.
And Doctor, the U.S. is administering more than 3 million vaccine doses per day. Nearly 20% of the population is fully vaccinated. And former FDA Commissioner Dr. Scott Gottlieb says the U.S. is unlikely to see a true fourth wave. Do you agree, Doctor? Is there enough immunity nationwide to prevent that?
Certainly having right now, we've got almost 20% of the population. We're not quite at 20%, but just under 20% of the population fully vaccinated. That is certainly significant, but it's not 100. We've got 75% of the most vulnerable population, 65 years and above, fully vaccinated. So that's critical, that group is now largely vaccinated, and those individuals who are most at risk in that category are much less likely to end up in the hospital and end up severely ill. But we've still got 80% of our population who is not fully vaccinated. And if you look at what's happening in Europe, we see countries, Italy was just in lockdown over this last weekend. Multiple countries in Europe have been considering lockdown or have been in lockdown, France, Germany. And what we see happening in Europe follows here in the US a couple of weeks later. So if we're looking at the pattern that has shown itself repeatedly with surges in the US that show up first in Europe and then later here in the US, we have to believe that a fourth surge is very possible, particularly in light of the steps backwards we've been taking in terms of our regulations. We've got 19 states without mask mandates, 2 more in the next 2 weeks are going to withdraw their mask mandates as well. We've got restaurants opening to over 50 capacity in many states across the country. Many states are fully open for business. And so those factors, combined with what's happening in Europe, combined with our recent spring break and the incredibly high travel numbers that we saw last week over spring break, I think are all sort of a mix for a very possible 4th wave.
All right, Dr. Susannah Hills. Doctor, thank you very much.
Thanks for having me.